Um, well, now you may think the economy is important, but I think to the most overwhelmingly immediate and important factor in all of this, which is health, and how health protection is the key to recovery of the travel and tourism sector. I have a panel of people here who have dealt with this and are wrestling with it right now. I'll just go through them quickly. We have the Honourable Majd Mohammad Shweikeh, Minister of Tourism and Antiquities from Jordan. Hello, we have Tom Jones, the Senior Partner at Healthcare Fin Partners. We have Rob Broere, the VP Industry Change of Airline and Emirates Airline, and the Chairman of IATA, Travel Standards Board. Professor Dimitrios Buhalis from Bournemouth University, and Ashwin Seetaram, who's the Director of Tourism at the Ministry of Tourism in Mauritius. Welcome to you all. Thank you so much. And I want to have some sort of interplay and make sure that we can all butt in. But I just wanted to talk to each of you very quickly individually. Tom, to you first. You've got vast experience, both from the healthcare in travel and the communications and PR perspectives about this. Your company has just released a report on the future of travel through the lens of sustainability, technology, and health. So what are its main findings? What can you tell us?
Yeah, thanks, Rajan. I really appreciate that introduction. And yes, Fin Partners has looked at all these dimensions. We're a multinational organization that looks at not only travel and the travel industry, but the factors that impact that. So you mentioned sustainability, travel, and technology. And so the report really predicts how, well, let's first just acknowledge that very few in the travel industry were prepared for the devastation of COVID. And, you know, what we wanted to address was the question of what next. And so the report really predicts how the travel industry will adapt from the standpoints of technology, sustainability, health, and illuminate a path to sort of navigate through this global crisis towards what, you know, many are calling our new normal. And so what it shows is that the post-COVID travel industry will really be informed by science and health in terms of, you know, we've all really been given a crash course in virus transmission and how we make decisions based on that. You know, COVID is going to pass, but there will be another pandemic behind it. And so suddenly technology has really become a new travel mandate, keeping us healthy. For those travelers who may already have been wary about germs, there will be new technology-enabled solutions to move them through airports, touching the least number of surfaces and items as they go. Instead of standing 6 feet apart to grab a cup of coffee, we'll have apps and different types of things that are, you know, emerging now that'll deliver food right to your gate. And there's, you know, UV technology that's going to be disinfecting people, such as in Israel, where they're, you know, using special UV lights to disinfect. And there's health and travel industry collaborations that just are designed to reduce anxiety and makes it safer and actually improves the well-being of the traveler. So, you know, and on the sustainability front, there's lots of lessons to learn. And, you know, in terms of impact to the environment. And things that impact our health, with attention being paid right now to improved environmental conditions. Now's the time to educate individuals for you know, for people to research setting a carbon budget and exploring carbon offsets. And with the current pent-up demand, there's an opportunity for the industry now to really help redefine what responsible travel means, by educating individuals about a personal responsibility and being respectful of the cultures and our impact on the environment. So it's a multidimensional report that looks at the travel industry through those three different lenses.
In your judgment, Tom, how well is the travel industry doing at the moment in handling things, and particularly obviously to do with health? What's the state of play?
Well, you have to look at it from the consumer's point of view, that, you know, and that their net optimism has really decreased. Most consumers continue to expect a long-lasting impact from COVID-19. And so, you know, I would say that, you know, some of the more impressive things that the travel industry has been doing is, you know, the World Travel and Tourism Council, as you know, launched the world's first ever global safety and hygiene stamp. Here in the States, we have a good housekeeping stamp of approval for products that are tried and tested and durable. And I think WTTC has sort of introduced that to, so consumers can kind of select and experience safe travels, literally. And I would like to, compliment Mauritius on achieving this recognition from WTTC. But other countries like Iceland, which has become home to the most aggressive COVID-19 testing regime anywhere in the world, is going to be opening soon. Jamaica is opening. And, these each have their own protocols, which are unique. And I think WTTC is doing a good job. And I think it's also interesting when you look at the travel bubble that's being proposed between New Zealand, which is completely void of any new cases, and Australia, which they hope that business owners hope will seed the seeds for businesses to survive. So it's been I would just say it's been a creative and interesting case study in innovation and creative problem solving for the industry.
Just finally for the moment, Tom, I mean, the bottom line surely though is, and I know plenty of travelers who are very cautious about this, who are worried about a second wave and all that happening. I mean, without a vaccine, nothing will be back to normal, will it? Really?
Well, you have to look at the end game. This thing is going to end in one of three different ways. One is that, we just, every single nation in the world were to have simultaneously stamped it out together. But now that how it's so widespread, the coronavirus pandemic is been hit 7.2 million people in 188 countries, and that's likely not to happen. The second thing is, if you would tear a page out of Boris Johnson's notebook, it would be that we just kind of let the pass through and eventually let it struggle to find a viable host. That would be what we call reaching herd immunity, 60 to 70 people around the world, but that would have dire consequences, leaving many millions of dead humans and a trail of devastated health systems. So the third scenario is really that the world will continue to play a protracted game of whack-a-mole until we stamp out the outbreaks here and there until a vaccine could be produced. This is probably the best option and also the longest and most complicated. Now, but the thing about a vaccine is that we need one that works and is widely available for all members of our society. Until that's the case, and until we reach that herd immunity, societies cannot in good conscience resume life as usual and travel as usual. So knowing what we know about this virus, and with this in mind, we really have to answer the question, what will travel and other aspects of everyday lives look like? I could say that, to your question about the vaccines, there's currently more than 100 projects looking at different vaccines around the world centered on the development of a vaccine for the coronavirus. There's also treatments, but most people are only interested in the vaccine. So far, 8 candidate vaccines are being tested in clinical trials in people. And so the earliest I think we can expect a vaccine, and Tony Fauci, our lead epidemiologist here in the States, says that we'll probably we should set our sights on between January of 2021 and the fall of 2021, and within that range.
Okay, stay with us. We're going to come back to you, and please join in and make your contributions as we go along with this conversation. I want to turn now to the Minister of Tourism and Antiquities in Jordan. Hello, Minister.
Hello.
Hi. Can you give us just briefly an idea of how badly affected tourism in Jordan has been by the pandemic?
Thank you so much. It's a great pleasure to be with you here today. I would say, as a proud Jordanian, we were extremely lucky with the wise leadership from His Majesty throughout the crisis journey. We had, honestly speaking, dynamics and new business model we haven't seen before. All agencies, government, royal court, intelligence department, armed forces, collaborating in order to have a very effective management of the process. Honestly speaking, at the beginning, we were too strict with the measures that have been taken by the Minister of Health. And it has been proven that these measures, although they were very hard and many sectors were hit hardly, but the results are fantastic, and really fantastic. Like we have now 830 in total number of people who got the virus. The recovery rate is very high. It's nearly 78%. We have 9 deaths among the 800, which is nearly close to 1%. It has been very well managed, very well controlled. And I would say that the dynamics which were witnessed throughout the period, I can call it transparency and agility, made a huge difference in how we worked and how we functioned. We all know now business is not as usual. We know that tourism was the biggest or the hardest hit came to tourism, especially after the growth and the success which was achieved in 2019. We had double-digit growth in revenues and a number of tourists. It was fantastic. So that's why when we had the unpleasant situation that we had all to live, we had to work a little bit on the psychology of the people by saying, if we don't take the strict measures now, probably the damage will be bigger and deeper. That's why let's at least contain the situation, try to control it. And today, only a few days ago, we lifted the curfew because we used to lock everything at 7 p.m. The restaurants were closed until last Saturday. The hotels are just now, we started to reoperate, and I'm preparing for the domestic tourism to kick off again. So the way we are handling it, we had to solve the immediate by making sure that we sustain and retain the people working in the sector. Now we are exploring the opportunities. At the same time, we are imagining the beyond the COVID and the situation we are living. So everything has to happen at the same time. Of course, all the tourism sector, they were in panic attack. What do we do? How can we survive? What do we do with our people? What do we do with our dues and liabilities? How can we manage it? So there is a huge cooperation as we speak between the Ministry of Tourism and the other ministries and the Ministry of Finance at the Central Bank of Jordan and the cabinet to support this sector. We have now a series of events that will take place hopefully next week by making sure that we achieve survival for the sector in order to be ready for the second hit. The hit is big, but hopefully we'll be able to recover smoothly. We are focusing on the niche tourism, starting by the domestic tourism. Then we have the filming, because the filming industry in Jordan is fantastic. And we have the south of Jordan, which is Aqaba, Petra, and Ram. These are green zones. So we are designing now a journey, end-to-end journey for people interested in coming for filming purposes in the south of Jordan. So it's definitely the name of the game now is agility. The name of the game now is definitely being innovative and creative, very creative, to make sure that we capture the opportunities, yet our eyes and ears and the hearts on the health sector, definitely, because this is our priority as we speak.
Just very quickly, Minister, I mean, the thing is that places like Petra, which would kind of rely, well, don't rely, but they are just naturally very crowded areas. With social distancing, how can you maintain a tourism industry in a place like that?
That's why I'm saying that we need to look at things differently. Business is not as usual. We are using the period now in order to enhance the infrastructure, enhance the system, train the people. That's why I keep telling everyone that we have priorities, and I keep summarizing these priorities as 4 T's and 4 C's. Trust, we need to retrust the journey. Transparency in what we're doing and how we are doing things. Technology is playing a major role, especially for tracing, for digitalizing the services, and definitely training. We need to train our people how to accept the new norm. So in Petra precisely, we are re-enhancing the infrastructure. We are digitalizing the journey of the person because we don't want too much of human interaction and paperwork. We're trying to customize packages for Jordanians because now it's very important for Jordanians because they cannot travel anywhere else. And we used to spend nearly 1 billion JDs outside Jordan in terms of external tourism. Now we need to rechannel this amount spent in order to benefit the local communities, be it in Petra, be it in Ram, in Aqaba, especially that we have more than 100 different experiences in the south of Jordan. Hiking, diving, fishing, golfing, everything you can think of, even meditation, even rejuvenation. So that's why we are focusing now on how do we capitalize the moment in order to entice Jordanians. And we are starting a program very soon. We call it Urdunna Jannah, like Jordan is heaven or heaven on earth, to entice people by subsidizing. And subsidization is very important for Jordanians. So we're going to subsidize 40% of the cost by incentivizing as well the service provider in order to give us proper packaging. All this is very well controlled by standard operating procedures, very heavy operating procedures for that whole journey to be safe, to make sure that sanitization and hygiene is embedded in the process. All people, they are now conditioned and trained on how to use masks, how to use hygiene, the social distancing. We rearranged and reorganized as well by putting plaster tapes on the floor, where to stand up, where to move, and how to move things. So we are redesigning, and I think design thinking in this process is very important, because we need to capitalize on what we know. We need to shape it, recustomize it in a way that we can definitely fulfill the new challenge, which I believe, in my opinion, I'm seeing it as an opportunity to reinvest, to enhance, and definitely to reshape the journey in a more, let's say, better customer journey way, to be more friendly and in a healthy manner, of course, because we strongly believe that in the future we need to stay alert and we need to stay focused on the health matter, especially when it comes to using masks and using the physical distancing and the hygiene.
Minister, thank you very much indeed for the time being. Again, we'll come back to you. I want to turn to Rob Broere from Emirates and from IATA. We're going to get to the issue of quarantines in a second, which I know is a big thing for you. But just enlighten us, in terms of Emirates, what kind of journey can a customer expect when they're going to or from Dubai Airport on an Emirates flight?
Okay, thanks everybody. The key part is that the health and safety of our passengers and our staff is crucial as a top priority. So we put a whole health regime in place, which is in line with the criteria created by ICAO, IATA, and WTTC, which is actually there. So it's based on everybody wears gloves, everybody wears a face mask. On top of it, we provide people at the check-in desk a health kit, which in fact includes cleaning wipes and other kind of things that, although we disinfect the entire airplane, people still can themselves apply the same thing again to make absolutely sure they're comfortable about it. When people arrive in the airport, we do temperature screening, which is more or less transparent because you just walk past it. And then it's a matter of reducing the amount of interaction between our staff and our passengers. So there's plastic screens at the desks, at the immigration desks. There's gowns which our staff wear. There's facial protection gear. It looks a bit like a hospital, but that's an unfortunate fact of life where we're currently into. And then you have the whole of the health and social distancing, which right now, with our percentage of passengers being in the single digits compared to what it was a couple of months ago, is not an issue because there's space enough. But ultimately, that might potentially start getting an issue when you reach 50% or more compared to the previous volumes. But that's not right now the challenge. And on board, we effectively, we limit the number of people which are allowed to go into a boarding area. You know, so with the seatings, only 1 out of every 3 seats can be used in the boarding areas. And the same thing on the boarding bridges. So what you normally see is that you have a huge queue of people trying to get in the airplane. That's all being social distance by allowing them in small groups at the same time. Then on top of it, we don't actually allow significant sizes of hand luggage to make the boarding process faster. So that all goes into the hold. And we pre-seat every passenger in advance of the flight. So there is no currently, we don't do actually online check-in at the moment. We actually pre-seat based on groups, families together, and then apply social distancing if the plane can handle it. Right now, the planes are full. So from that perspective, that's not an issue. And then furthermore, to introduce actually the reduction in normal food service, we provide actually a box lunch to allow people to get it there, which again is much more of a safe there. On top of it, we actually, on the A380, for people which have flown first class on A380, where we have the shower cabins, which of course we're not flying the A380 at the moment. But we actually have what is called cabin service attendants, which were actually responsible for that. We now put one on every Boeing 777 to continuously keep cleaning all our public bathrooms, making sure that those are lined with everywhere is. So these are all the kind of factors which we just try to make, both for our passengers and for our crew, as safe as possible, taking also into consideration that airplanes itself have an extremely efficient filtering system of air, and the air comes from top to bottom.
Okay, well, let's now deal with the issue that's concerning you most, which is with the IATA, which is how to open borders without 14 days quarantine, while significantly reducing the risk of importing COVID-19 compared to open borders. What's your view on this? I mean, I know what your view is. You're very anti-quarantine, is that right?
Yeah, no, I think the key is for us as a long-haul carrier, like opening up domestic doesn't mean we don't even fly any domestic flights. So for us, it's key that we actually start getting movements between various parts of the world. The process of everybody goes into a quarantine doesn't actually make sense from an overall perspective. Like there, if we start opening flights to New Zealand, it doesn't make sense to put people into quarantines in Dubai because there's no infection in New Zealand anymore. Yeah. Well, the other end, you can argue, should the UK have quarantine for people coming in from New Zealand or from countries like Jordan, which have a very low infection rate? So the first thing, I think countries need to make up their minds and much more segment the places where people come from based on risk base to start saying, who do we allow in? Then to overcome the quarantine. Quarantine will kill business travel and will kill about every travel other than repatriation and visiting friends and relatives who are willing to stay for a longer period. So the key there is that we need to get into a combination of a set of tests where the test can be done before departure, and then potentially, if depends on the risk, is a very high area, another one after arrival. And the medical professionals are say, if you actually do 2 tests, with a 3, 4, 5 day in between, you probably have 99.9% reduction in somebody bringing in the virus into the country. Now the key is that how do you come to a regime that a country where you fly to is willing to accept a test which is being done in a different country? That's where I think the whole global standard ecosystem needs to come into place. There are thousands of technology solutions, and I've spoken to many of them, who's also saying, oh, we have it cracked. But it's based that the entire world uses one technology solution. And that's utopia, that's not going to work. So we now need to say that if a test gets done in Dubai, that is done by a health organization which is approved by the government, that it uses a test kit which is approved, yeah? And that the information of the test outcome is visible in a level of privacy to the government where you're flying to, so that they automatically know that this individual is actually being properly tested and can actually be accepted into their country as a low risk. And I think that's the way is that the quarantine is a last stopgap, which you might want to do only in serious case, but right now it's the first case the government's put in place.
What about the argument that the British government, for example, put for quarantine, which is that when you have a low rate, that the really good way to stamp down on the spread of infection is to impose a quarantine for a short period of time? What do you say to that?
You can argue about, but in the case of the UK, I would say I would be more worried about that I get COVID-19 when I walk into London, versus than I actually coming from a low-risk country into the UK. It's the kind of thing. Right now, does it actually make sense for a country which is one of the highest infection rates? Is the UK currently, the biggest problem in the UK currently is people flying in and local spread. Yeah, so, but for countries which have a lower risk rate, like New Zealand, they will have to find a way to overcome it. And quarantine is the best way, but that's not travel. There's no holiday. It means 3-week holiday, and then be 1 week on holiday, and then be 2 weeks back in quarantine in your home country. It just kills travel totally. And there are other ways of doing it. And the cost of testing is going down. And I think many people are willing to actually pay for their tests to be able to allow business travel to start, to be able to allow visiting friends and relatives. And if you actually say the tests are expensive, the UK government could scrap the departure tax, and probably that's more expensive than the test cost.
Okay, a nice dig in for the departure taxes. Yeah, great. Stick around, because I want to talk to you as well about how these things would affect, for example, the customer experience at airports in terms of queuing and waiting and all that stuff. But we'll come to that in a second. I want to go to you, Dimitrios, because I mean, we've heard about health here, and perception of health and safety really is what is key here. What are the pitfalls, as far as you're concerned, of perhaps rushing in too soon to push travel too much?
Rajan, I think the issue is that a lot of governments are facing the economic pain of the coronavirus, and I think they are rushing through to actually bring tourism activity coming forward. And everybody would like to see planes going and would like to go nice places and would like to do great things. But I think unless we are all responsible, we'll face more severe situations later on, because inevitably, if we have got several waves afterwards, we may need to close again and go back to very strict measures. I think we have never seen a crisis like that, because what requires that everybody is responsible, and requires from the traveler, from the company, from each single employee, we need to be responsible for the way we are treating things. I think we really need to show solidarity and collaboration and competition, in the sense that we need to share all the best practice. We need to share the protocols. We need to share what do we do, rather than keep that to ourselves as a competitive advantage. And I think the tourism industry has never done that before. We really need to operate in very, very different ways. I've been asking the global companies to actually share with everybody else what they do, and Rob from Emirates and hotel companies like Hilton, Intercontinental, Marriott, they really need to show to everybody how we can do that best. And it's all about sharing and caring at the same time.
When you think about how everyone is talking about traveling again, I mean, I have friends and relatives who are very, very cautious. We've heard Tom talking about the kind of measures they're going to bring in and the kind of technology that's available. We've heard from Rob too about airlines. But the normal person, if you like, I mean, your family, my family, how reassured will they be by this?
I think what's going to happen is that the people who need to travel will start traveling first, and this will be people that they've got to meet relatives, family, whatever, and to actually take care of their personal business. I think the second group that's going to be traveling is the business travelers, that they need to go out and do what they need to do. And I think the third group that is going to be opening eventually will be the leisure travelers. I think leisure travelers will be a little bit slower. I also segment the market in 4 different segments. The first segment is those people who are shielding. These are people who may be older, or they may have particular illnesses. There's a second group of people that they are really impacted by the economic situation. They may have lost their job, they may have lost income, their mortgage may have gone up, something that has severely impacted their economic situation. I think there's a third group, which is the smart travelers, that they're waiting to see. They're waiting to see Emirates flying, how many problems is going to be, what else is going to happen, how many people are going to Jordan. And then eventually in about 3 to 4 weeks' time, they'll be traveling. And then there's another fourth group of people, which I call kamikaze. It's the people that are going to travel under any circumstances. And we saw them in Bournemouth last weekend. It was a very nice weekend in Bournemouth. And everybody, and a lot of people went to the sea. And the first group was looking at them and saying, how dare you, you're going to kill us all. But that kamikaze kind of group is going to go no matter what. And that is a major issue for me, because I'm not sure if they're responsible, if they'll keep social distancing, if they wear their masks, if they take seriously the protocols. And I think it's our responsibility to make sure that we first encourage and inspire these people to actually use the protocols. And the next thing is to create penalties if they don't. And we hear a lot of stories about, and let's face it, in tourism, we are not going to tourism to be apart. We're going to tourism places to be together and to enjoy each other's company, to eat, to drink together and have fun. And I think especially when people have a few drinks and people see families and people see their friends and their loved ones, it's inevitable that they're going to go and give them a hug. And it's inevitable that they're going to have a conversation. It's kind of inevitable that they'll feel this false security that we are safe with our people. And I think responsibility is the most critical bit that we need to keep in this kind of context.
When we have time, but if we have time, we'll certainly talk about, I think, the policing almost of these kind of measures that you might need, and certainly for people who may not be as responsible as others. But before we get to a general conversation, and when we do, I'll ask all of you to just raise your hands so I can bring you in. I want to turn to Ashwin Seetaram, the Director of Tourism in Mauritius. And as we've heard, you've been accredited, you've been applauded for your blue chip approach to health and safety. But what is that? What did you do when the crisis broke out, and how did you respond to it? I'm wondering if you pressed your mute button. Hang on, unmute.
Sorry.
Yeah, it's okay. There you go.
Okay, that's good. Yeah. Hi everyone. Thank you, Rajan. In fact, it's not when the crisis broke out, but we have been monitoring the situation since January. Okay, we had a very good month for tourists in January, double-digit increase in number of arrival. But we've been monitoring China, which is a major market for us, Italy, another major market for us. And in February, 2nd of February, we had to stop the flight from China because it was getting like really serious there, and we had to stop. Mid-February, we had to stop the flight from the tourists from the affected zone from Italy, and then gradually other countries getting contaminated. We had to stop until we got contaminated. We got our first case on the 19th of March, and then 20th of March it was the confinement. Confinement started. And when confinement started, mean like all borders were closed, everything was closed, all tourist operations stopped. Tourists that was there, the manager, like there was some flight that they went back to their country, or others just stayed on the island. And yeah, from 20th of March till 30th of May, it was confinement. Hotels were converted into quarantine zone because the only flight that we had was Mauritian citizens coming back and cargo flights. So when they come back, the quarantine was compulsory. 2 weeks, we gave them hotels. So it was much better than hospital. Yeah, so, and during that period, we lost 15 billion rupees, mid-March till end of May, compared to the same figures of last year. But what we did, we've been monitoring the situation everywhere. We started working on sanitary measures for each activity that we have in our Tourism Authority Act. Each activity, we came with guidelines, with sanitary measures that they have to follow. Of course, bearing in mind the physical distancing, hand sanitizer everywhere. Yeah, all the time, like regular cleaning of equipment whenever someone is using it. So we came with that. We work on it, and then we found out about WTTC. We contacted them, communicated with them. They endorsed our guidelines. They gave us, of course, some changes, some amendments were made to it, like we don't talk about social distancing, we say physical distancing. A lot of support they gave us, and they endorsed the guidelines. So now what we did is every operator, they are self-assessing themselves. They had to do everything. The pass mark is 100%. They do everything, they get the certificate, and we go and monitor, we ensure that they're doing it. We have to do it because in the near future, safety is a major issue. So we have to do it. So this is what we've done. And we're happy to be the first island in the region to be endorsed, to get the stamp.
So when will tourists from abroad be able to start coming into Mauritius?
Well, in fact, we've already worked on the guideline on the security on the island. I have to say that since the end of April, we haven't had any case of corona on the island. Okay, we had 3 cases, but it's from Mauritian citizen coming back to the country. That's it. since end of April, we didn't have any case, and end of May, it was the end of confinement. But we know there's a report from IATA, report from other institutions. We are monitoring, looking what everywhere other countries are doing, because we understand the quarantine, because tourists come to Mauritius for an average of 10 days, quarantine of 14 days, that would be hard for them. We will not expect tourists for that. So we are working with the health expert, the Ministry of Health here, to ensure to get the best, I would say, the optimum way, the optimum protocol to be able to put in place, and then we will decide when to open. But there has been a joint working group with the private sector and the public sector. We've been looking at strategies. We've been communicating with the market just for them not to forget about Mauritius, talking about the beauty of the island. And we don't have a date yet, but once the protocol will be decided, then we will communicate on that.
Okay.
We may be starting with like the island, the surrounding, the regional market before going to long haul.
Okay, right. I want to open this up a little bit now and ask you all. Now, I mean, we're talking about countrywide in protocols. We're talking about big organizations, but what about the small operators? Because I suspect there will be corners being cut. Small business people can't necessarily afford to do a lot of these things. They won't necessarily, one person operation that may just not be able to monitor so much social distancing, if they have a group of people, for example. How can we make sure we do this without being too heavy-handed? Because it's supposed to be a holiday, it's supposed to be a time abroad, and yet we may have this situation where there's a standoff, where people are saying, you can't do that, you must not do that. I wonder if anybody wants to respond to that.
I think, Rajan, you make assumptions. I think small does not mean incompetent. I think that quite a lot of small businesses will be actually much more careful, because quite often they live on the premises. It's a family business quite often, and they operate those businesses. It's equally difficult when a waiter goes in a 5-star hotel and then goes out in the community, and then it may be spreading. So you cannot actually make that assumption that the small will be more dangerous. What the small businesses will need is better guidance, and probably in a language that it's really accessible to them. I've helped a lot of small businesses in Greece and in Bournemouth to actually understand what is required. And one of the proposals I've done on the islands of Corfu and the islands of Rhodes is that a big company adopts a small one or a few small ones in the region, so that they all sing from the same hymn sheet. Because it's really, really critical that everybody understands. So the small businesses may not have the resources and the expertise to understand a different kind of level, but they'll be equally responsible and even more responsible than the larger ones. So for the ministers who are listening to us, I think it's important to actually bring those kind of measures and the training, and actually get people to go around the small businesses and ensure that the protocols are understood and they are followed in detail.
Is there ever a trade-off? I know a lot of people, I know, Tom, you talked about how sustainability is important as well moving forward. But in terms of trying to deal with the coronavirus measures that you need, and trying to move forward with green measures or environmentally friendly measures, is there ever a trade-off with that? Can you ever see a time when you can't just do both? It's too much to handle. Can I come to one of you? Let me ask you, Minister from Jordan.
Actually, I'm trying to reflect on what has been said first on the small businesses, because we believe that in Jordan, for example, for the small businesses, mainly for the small handicrafts and all these people, we're trying to train them. And that's why I insist that training is very important, and capacity building on how to deal with the situation. But looking at the trade-off, I don't see it as a trade-off. I see that we need to, whatever we put in place in terms of measures, they have to complement all the other efforts that are being done by the different stakeholders. So awareness is very important. And to me, when I talked about certain measures, I need to go back to what do we need to make sure that they are in place. For now, what has been said that we have different protocols for the different journeys, but we need compliance. Compliance must be built throughout the process. We should not take things for granted, because from my experience, when we started to open the restaurants, for example, although we put very strict measures, but first day, second day, third day, they started to act normally as if there is nothing. So that's why I think we need to keep reminding them. Communication is very important. Capacity building is very important. Certification is very important. And I really like the idea of self-assessing. So I think this is a new, let's say, way of looking. How can we enforce or actually insist that they need to feel the responsibility, and they need to be committed, and they need to self-assess. Now it's shared responsibility era. We can't go into a blame game, and we cannot just say we cannot do this and we cannot do that. I think now it's the time in order to think of how do we need to overcome this period. So this is how I look at things.
Rob, I think, did you want to, oh, sorry, go on, Ashwin.
If Rob want to go first? Oh.
Okay.
Rob,
did you?
In fact, I would like to add, I would like to share what we've done here. Like I said, the guidelines has been endorsed. The guidelines is for every activity in the tourism sector, even a one-man business. Okay, if you're a hiker, he has to do his operation. He has to follow the guidelines about hiking. So this will become a condition to their license. Okay, if they do not abide to it, they may go they may risk of losing their license. They have to abide it. And moreover, the people has not worked for 2.5 months. They've experienced the problem of having confinement, of having curfews, all that. So not to have this situation again, they know the importance of abiding to the guidelines, of abiding, make sure that social, physical distancing and all the protocol are adhered to. So it's important, as a whole population, we went through it and we know the importance of it. So we don't want to go into curfew again. So we'll have to abide to it.
Okay, Rob.
I think it's also the guidelines that they're fine and that needs to be enforced, but the challenge is also the global cultural differences. I've been myself walking around in the airport and watched the departure process of a couple of repatriation flights. And for some flights, the people nicely social distance and 2 meters apart. So on other flights, our ground staff spent continuously doing people putting 2 meters apart. And when they got to the end of the queue, the front of the queue was already back again. It's a kind of cultural challenges, because in some countries, if you leave a gap, somebody will jump in the queue. So there's some automatically the social distancing is just not a part of the framework of the people's culture. And that's actually a challenge if you work in a very multicultural environment. And I'm not sure how to crack that easily.
It's a fair point. Does anybody want to come up on that? Yes, Tom.
Yeah, hey Rajan, there's just one thing that I wanted to add on to all of that, or actually two points, is that, whether it's guidelines or self-assessing, the important thing I think also that's really the trend that people have to take a look at is just how sexy it is to have an epidemiologist in your country that offers reassuring data. And all of these things kind of combine for really important message points to get out to your consumers, of the buying folks, the ministers of health, everybody, the WTTC. All of that needs to combine into one singular communications strategy that I don't care if it's a small boutique hotel or if it's, Westin hotels, or like one of our clients, Six Senses in Asia, that is doing such interesting stuff. That's all really, really important. That's the first thing I think that we have to get across here. The second thing that I just wanted to point out is something that I want to pick up on your guest from the previous session said from PwC, and that is the role of wellness. We haven't talked about that here, but that's a really important point that I think, and a trend that everybody needs to capitalize on, because consumers are so much more self-aware now of their own immune system as it relates to, how do I avoid a pandemic? How do I vacation healthfully? But how do I also use that all this pent-up demand for people to go and travel, now that they're also self-aware of their immune system, how do destinations make that an offering to really help them understand, you know, how do I diet and exercise, and how do I, you know, get to a better place of wellness? And there's a lot of places that are doing it well, and particularly in Asia.
It's a very, very valid point, actually, because it occurs to me, and I don't know if anybody else has to make a last point and come back on this, that it's not going to be the crowded urban areas necessarily that will do well. It's going to be areas in more quiet regions where wellness, for example, is promoted, where people have, I don't know, meditation, or they have all those things. I mean, in terms of investment, this is an investment conference. I guess that is the way, that's certainly one way in which the industry can push and move forward. Anybody want to make a last point? Dimitrios, go on.
Rajan, I'd like to pick up from what Tom said about communication. I think it's really critical people to understand that they do not promote destinations as safe. Nowhere is safe. And I've seen a lot of places talking about COVID ready, COVID safe, or whatever. It can be very, very easy to actually go away from that. I think what people need to promote is that we all need to be responsible. It's like alcohol or tobacco, you know, consume responsibly kind of thing. Be part of the safety. You are part of the safety network and the safety processes as much as we are. And also, a lot of people will go into the quiet places, you said, you know, the remote places. But I'm really very nervous about that, because the more remote places you go, the less health facilities you have got, the less access to medical support you have got, which means that we may actually have more impacts into societies that they are not prepared to actually deal with that. So I'm really careful about the word safety, if you like, and I think we need to communicate to everybody that they need to be responsible in this process on how they are going to engage in the tourism activity.
Okay, well, thank you all very much indeed for participating. I mean, this is the most crucial element of all this stuff. We'd all love to travel, but the bottom line, health is always going to come into play. We all know our families. We all know people in our families who are very nervous, very anxious. And the whole point is to be responsible, as you say, and to reassure. Thank you all very much indeed for that. Hope you stick around and see the rest of it. Thank you. It gives me great